afternoon, and thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. And we are also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon, and a quick reminder that if you have a question you'd like to ask, and a lot of you already have, but in case you have not yet submitted your question, just click on the text bubble with the question mark here on Microsoft Teams, indicating your name, your media outlet, and who your question is for. And finally, a welcome this afternoon to folks who are tuning in on Rogers Television, as well as the Rogers Facebook page and YouTube channel. Listeners on Global News Radio 980 CFML, and those who are watching, rather, on the CTV London website. Let's get to the opening remarks. We'll start today with Mayor Ed Holder.
Well, thanks, Dan, and good afternoon, everyone. Now, tragically, we've had 3 more reminders today about the severity of this pandemic. 3 more lives lost in our region as a result of COVID, including an 18-year-old young man. Our thoughts and deepest sympathies are with the victims' families and their loved ones. So for anyone out there that imagines that this is a hoax or that this is some kind of a conspiracy or some form of untruth, tell that to just dead, and that by the end of this week we'll likely hit 11,000 COVID cases. Tell that to them. In spite of that, that reality, we continue to have people who refuse to think about other people, and perhaps in all likelihood refuse or don't know how to think, period. Yesterday, for example, bylaw enforcement officers issued a ticket to someone who is using Thames Valley Golf Course. That's after several people did the same thing over the weekend on a Fanshawe course. I indicated we find out that the people are, and they'll be charged, not because we want to, but it's public safety, and that's truly what this is about. We had a 20-year-old charged for hosting a gathering on Talbot Street, another individual for attending a gathering on Hyman, and 2 more for attending a party in a neighborhood near campus. Not only that, but fines have also been issued to 8 businesses now for not adhering to various provincial regulations. It's not a victory to fine people, it's a loss. It's a defeat because somehow some people think that they can set their own rules, and it doesn't work that way, not in the middle of a pandemic. I spoke earlier about this week about the addition I made recently to my email signature, and it bears repeating. It starts this way. It says, gentle reminder for us all, now is not the time to let our guard down. And I have 5 bullet points. Wear your mask. Physically distance. Wash your hands. The results we get. And there's an irony. Next week marks National Nursing Week. And I've said before, and I'll say it again, particularly when anyone refuses to do the basics, you're actively insulting and disrespecting the lives of frontline workers everywhere. National Nurses Week, think about that for just a moment. These people, along with other members of our medical community, make such incredible sacrifices on our behalf, and they do it day after day, hour after hour, month after month, and they've done this now since this pandemic began. Sacrifices few of us can even begin to imagine, personally or professionally. They've literally risked their lives. We owe it to each other, and most of all, we owe it to them, don't we? To take the month of May, the month in which we finally break the back of this pandemic, and it can be done. However, that back won't break until some people give their heads a shake. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. So lots to update folks on today. First of all, on the AstraZeneca vaccine campaign, we've now had over 22,000 AstraZeneca administered in pharmacies in this area, and the 5,700 that have gone to family doctors have also been administered. Across the province, that's about 900,000 vaccines. What we know is that most of those vaccines went to people aged 40 to 60. And if you look at the disease rates, hospitalization rates, and death rates in that population, you can calculate how many lives, cases, and hospitalizations were prevented through AstraZeneca in this province. I've done the math. There have been about 1,700 cases of COVID prevented by AstraZeneca vaccine alone in Ontario, about 61 hospitalizations and 6 deaths. All that, and we know that there have been something in the range of 2 to 4 blood clots that have been caused by the AstraZeneca vaccine versus 6 deaths, 61 hospitalizations, and 1,600 cases of COVID prevented. That's not to speak of the spin-off benefits to vaccinating those 900,000 people between 40 and 60, which would have included thousands of additional cases prevented in people where they would have spread the virus to. We also have some good new data about vaccine effectiveness in Ontario. We had the cases among people vaccinated being reported by Public Health Ontario for the province yesterday. Those numbers are very good. The rate of cases in people who have been vaccinated is extremely low, about 6 per 10,000. Very, very strong data there showing vaccine effectiveness in Ontario. I do want to mention the information about the 18-year-old who passed. We don't have a tremendous amount of information. Unfortunately, the other people in his family are also sick, and so it's difficult for us to get full data. But at this point, we believe, we know this is not a person who was in post-secondary. We don't believe that this was a person who was a high school student either. Haven't been able to make any connection with high schools at this point. We also don't know if there were underlying medical conditions. No information about that. Coroner is investigating, so we will have more information at some point, but that will take some time. So I mentioned the 22,000 vaccines that have been given in pharmacies, almost 6,000 in primary care. When you add those to the totals through the mass clinics and mobile clinics that Middlesex-London Health Unit and partners have been operating, we're now over 190,000 vaccines given in Middlesex and London. That will hit 200,000 at some point on Saturday this week. So very exciting to be approaching that milestone. One other thing I want to mention is the request from Thames Valley District School Board for parents to elect either in-person or remote learning. As Medical Officer of Health, I want to recommend that parents choose in-person learning for this fall. And there are a few reasons for that. First of all, we saw very low rates of COVID in students here, even during those first and second, and even the beginning of the third wave. Second, great news today, vaccine will be available at some point over the next few months for children in Canada. Health Canada made an approval today for Pfizer vaccine to be given to children as young as 12. Now, on the heels of the death that we had in an 18-year-old today, the importance of vaccinating children could not be more apparent. And so this is tremendously positive news. We don't have information on timing there. We haven't got provincial direction yet around how children will be prioritized relative to other groups. But hopefully by the fall, we can start vaccinating children as young as 12. And studies continue to test Pfizer vaccine in younger children as well. All of that will make a huge difference. And for families that have really been through stressful times over the past year and a half, it will really be a major source of relief and peace of mind. That's it for me for now. Looking forward to questions, Dan.
Thank you, Dr. Mackie, and thank you, Mayor Holder. And yes, there are a lot of questions, and several of them, as you mentioned, do relate to the reporting today of the death of an 18-year-old male. So I will adjust those on the fly if we can, because there are some questions in there that I think Dr. Mackie will be able to comment on. Carrie McKee at CBC London has the first question this afternoon, and her question is about the death of that 18-year-old male. We know that there aren't a lot of details that we have or information that we're able to share, so I'll just move down to the part of Carrie's question where she asked, How difficult is it to lose someone so young?
Well, thank you, Kerry. And yes, as Dan mentioned, we're still gathering any information about whether the person had pre-existing health conditions. It's a major loss to our community and a sign that COVID is not going to respect previous boundaries, particularly with the new variants of concern. We're seeing more spread among young people. It's a big concern. It's our next frontier, and just very much looking forward to being able to vaccinate people in that age group. I see that the mayor would like to speak to that as well, although I think we're losing his video feed.
I think we're good, Dr. Mackie. Mayor Holder, if you have some comments to add.
Kerry, what's it like to lose an 18-year-old? I don't know. I can tell you what it's like to lose a 14-year-old. I lost a 14-year-old son and attended 3 families where we have seen parents who have lost children of various ages. I only interceded in this particular answer because there's no words that describe when you're a parent what it is to lose a child. It's totally devastating. You can't plan for it. And you never lose that feeling of tragedy and sadness. I liken it sometimes to a black hole with razor blades, and from time to time the razor blades go away so they don't cut you up all the time. But the black hole never leaves. And I give you that as someone who lost a child almost 25 years ago. And so there's a truth that for these people that have died, some older, yes, some like the 18-year-old, they all had parents. And if those parents are alive and their extended families, it's a tragedy that never gets answered. And every family will tell that same story of heartbreak. And that's why they're very much, this family particularly, and the family of the other 2 individuals who died, because it doesn't matter what the age, but particularly a child, I think it resonates most of all. So horribly, horribly sad, and our prayers and thoughts go to those families.
Thank you very much, Mayor Holder. The next question is a follow-up from Kerry McKee. Dr. Mackie, this question is for you. Dr. Mackie, the downward trend in new cases is happening much slower than the second wave. Is this simply due to variants of concern? Do you agree with other experts who say we may have to extend the stay-at-home order that's currently in place?
Yeah, so thanks for the question, Kerry. Variants of concern are a major factor here. Essentially, the variants of concern have competed out the other variants of COVID. And so in that sense, the good news is that we basically ended the first COVID epidemic. We really aren't seeing much spread of the original COVID virus. The bad news is that this new virus does spread more easily. And that is a big reason why we're seeing the drop slower than the other waves. I think it's too early to say if the stay-at-home order will need to be extended, but that is certainly possible. If you look at the rate of decline and where we need to be, it looks like we would need probably another 4 weeks to get down to, around 1,000 cases per day in Ontario, which would be, something in the ballpark of where we opened after the second wave. And that definitely will take time. The positive we have is that the death count is staying low. The other major risk, though, beyond cases, is ICU capacity. And we're just beginning to see that, I would say, level off in terms of the cases on ICU, more so even than dropping. And if the government really wants to avoid using that triage protocol where people who need ICU wouldn't be able to access ICU because they're full, then I wouldn't be surprised if there is an extension of the stay-at-home order for some time. All of that is still, from my perspective, very much up in the air.
Thank you, Dr. Mackie. Let's go to the next question. It's from Jennifer Beeman at the London Free Press. Dr. Mackie, had any of the 3 deaths reported today received a COVID-19 vaccine?
Thanks for the question, Jennifer. None of the 3 deaths reported today had received a COVID vaccine. And I can commit that we will report that. If we do have a death that has a COVID vaccine, that person that has been vaccinated, we'll make sure that that is flagged, whether it is through our daily dashboard reporting or otherwise.
Thank you very much, Dr. Mackie. A follow-up question from Jen Beeman. Dr. Mackie, how does the death of someone so young affect the health unit's team of contact tracers?
Yeah, I mean, anytime you see these sorts of really unfortunate cases, it has an impact on staff. We have, many of our staff who are parents themselves, and to witness a family go through this, that can be really difficult. I haven't spoken directly with our case contact management team today, but I know that these sorts of cases have certainly hit hard in the past.
Thank you, Dr. Mackie. And Jennifer Beeman did have another quick follow-up. She was asking if we know whether this person who passed away, the 18-year-old male, was an essential worker or if they had been hospitalized.
Yeah, I'm afraid we don't have that information. In terms of the hospitalization, essentially, so we don't know if the person was an essential worker. The individual declined very quickly. So respiratory distress, went to hospital, all passed within the same day. So, we had essentially were informed about the case around the same time as the fatality occurred, hadn't even had a chance to begin the case investigation.
The next question is from Jane Sims at the London Free Press. Dr. Mackie, Jane would like to know, the youngest adults won't be given a chance to book vaccination appointments until May 24th. Given the death of an 18-year-old in the region and the large percentage of cases involving people under the age of 29, should we be opening up vaccinations to anyone 18 years of age and older?
Appreciate the question. As always, we wish we had enough vaccine for everybody that wanted to get vaccinated right now. The issue right now is that we would have to rob Peter to pay Paul, and people, as much as it is tragic to see a death in a person who's 18, we know that age is a major factor, and so we would have to bump people out of the queue who are at higher risk of dying if we were going to open to younger. We did an analysis recently of the cases over the last week. You'll recall that 2 or 3 weeks ago, vast majority of cases were in people from age 18 to 29. That is no longer the case. The age group is still overrepresented. So about a third of our cases over the last week have been among people aged 18 to 29, but they aren't the majority as they were. There's also a bump in those age 40 to 49. So for some reason, people in their 40s are, over the last week, acquiring COVID at a somewhat higher rate than those in their 30s. We don't have a great explanation for that. It's certainly not the major driver that the younger crowd has been in the past, but it's an interesting finding. In any case, the risk of death remains much higher as the decades of life progress, and that's where we need to be focusing the campaign right now.
Thank you, Dr. Mackie. And a follow-up question from Jane. With vaccine supplies expected to ramp up in the next week or so, and with more people becoming eligible for a shot, what is the status of the Nichols mass vaccination clinic? Can we expect it to open next week?
Thanks for the question, Jane. We won't be able to open Nichols next week. We will be able to announce our date for Nichols next week, so we're confirming the logistics there. And we'll be able to announce when Nichols will open next week. So as always, I know people love the announcements about announcements, so happy to be able to bring you that one today.
Jennifer Beeman is back with another question here from the Free Press. Dr. Mackie, are you expecting to open vaccine eligibility to the 40-plus crowd, the second group of workers, and at-risk health conditions next week? Will all of this happen on the same day?
So we're meeting with the province this evening. So there are 3 meetings each week with medical officers of health and CEOs of the vaccine hospitals with the ministry. We'll be hearing about the province's plans to open up to that group. At this point, we are confident we will have adequate space in our clinic bookings in the sort of 2 to 4 weeks time frame to be able to open to additional groups, just looking to align with the provincial timing on that. My understanding is that the province is likely to open to additional groups no more frequently than weekly. So we would think, next Thursday or Friday would be likely the date that we open to 40 plus and the second group of essential workers, but that is to be confirmed.
Thank you, Dr. Mackie. Let's move to a question from Steve Young from CTV London and News Talk 1290 CJBK. Dr. Mackie, is the 3 deaths being reported today the highest we have had in a single day since the pandemic began?
Yeah, it's not the highest we've had since the beginning of the pandemic. We are now reporting our deaths by week. We don't have them by day on the website, but we do provide them by week. And if I recall correctly, the high was around 6 in a single day, something in the 6 to 8 range. So we're not there. This is certainly the highest we've seen in at least a month, though, Steve.
Thank you very much, Dr. Mackie. If I may, we had the crack team. Mike Stubbs will appreciate that. I know he's listening this afternoon. In the background, working on that. And you're right, Dr. Mackie, the number was 7, and it was reported in January, on the 17th of January. So thank you for the question, Steve. Let's go to the next one. Andrew Graham from Global News Radio 980 CFPL. Dr. Mackie, is the 18-year-old's death being reported today indicative of any trends related to the local spread of COVID-19?
I would say that it certainly is, Andrew. We've seen this population being hit hard by cases. It's the first death in that population in this wave. But to be clear, we don't yet understand or have information about any link between this case and the parties that we're seeing a month or so ago that were generating a lot of cases in this age group. So from that perspective, we can't definitively make a link with those high-risk behaviors, but it is another reminder that people in young adolescents and older adolescents remain at high risk of developing COVID.
Thank you, Dr. Mackie. Jennifer Beeman from the London Free Press has another question. Dr. Mackie, a provincial report obtained by the Free Press found opioid overdoses in London increased 66% in 2020. Has the pandemic shifted the health unit's attention away from this issue? What is being done to prevent a similar spike this year?
Well, in the sense that a lot of our epidemiology resources have been devoted to the pandemic, it certainly has been a factor. The programs to address the issue remain in place. We still have, a supervised consumption facility, consumption treatment services operating in the area. We still have the outreach team working with that population. And we still certainly have, naloxone distribution programs, which have actually had a big increase in demand over the past year. The unfortunate part of the pandemic, one of the things we recommend in order to help prevent overdose deaths is that when people are going to be using opioids, that they don't do so alone and they have somebody present who has naloxone on hand so that an overdose can be reversed and 911 called as appropriate. Obviously, when the direction is to stay home, not gather, and don't enter other people's homes, then the likelihood that somebody's using an opioid by themselves increases substantially, and that's a big part of the increased number of deaths. We've also seen the pandemic take a major toll on mental health, and that certainly is a factor here. So all of that combined just adds to the underlying issues that were driving the opioid crisis to begin with.
Our Our next question comes from Andrew Graham at Global News Radio 980 CFPL. Dr. Mackie, have any COVID-19 cases been linked to the London Public Library's central branch? If so, what can you tell us about the response to those cases?
Hi, Andrew. I'm not aware of any link with the London Public Library central branch at this point. Certainly no outbreak going on that we're aware of. I'm actually not quite sure where the question's coming from, so I'm afraid I don't have much more on that.
Jane Sims has the next question, Dr. Mackie. The stay-at-home order is scheduled to be over on the 20th of May. Do you think we will see enough of a decline in cases and hospitalizations in order to lift the order?
At this point, very unclear. One thing that may happen, I mean, there are some certain things which could be done that would be very low risk, such as opening up some of the outdoor opportunities. Outdoor continues, even though the variants of concern are spreading more easily, it's still about 20 times safer to be gathering outdoors than indoors. So that might be something that happens around that time frame, but it's still too early to say for sure.
Dr. Mackie, we have another question from Andrew Graham. Dr. Mackie, what can you tell us about the latest long-term care outbreaks? Were staff and residents vaccinated prior to those outbreaks occurring? If they weren't vaccinated, why not?
Yeah, so thanks for the question, Andrew. All of the facilities have been offered vaccination. Vaccination rates among residents and staff in long-term care and retirement homes have been excellent, well over 80% and in many cases 90% range. Not all people have chosen to be vaccinated. There's no compulsory vaccination right now. And part of what's happened is as new staff or residents come into a facility, they aren't necessarily vaccinated before they enter the facility. So that plays a bit of a role. And the one long-term care associated death that we saw was not vaccinated. I don't have details on why that was the case, whether it was a new resident or somebody that declined vaccination, but that certainly was the case with that individual.
The next question, Dr. Mackie, is from Ashley Govias at the Western Gazette, and I think Ashley may have joined us late. Ashley has a question about the 18-year-old who has passed away. I know we're not able to answer this, but she does ask if this is a Western University student.
Yeah, we're pretty confident that this is not a post-secondary student at this point.
Jennifer Bateman has a question related to this young man as well, Dr. Mackie. You said this young man deteriorated very quickly. Is that something the health unit is seeing more during this wave of the pandemic?
Well, I wouldn't say that we're able to say with any confidence that this is happening more quickly. Obviously, there was a unique situation in this individual. We do not get deaths in people of this age group very frequently. And that's certainly, this would be among a handful across Canada during the entire pandemic. And so there was something underlying here, whether it was, there are many sort of undiagnosed immune system differences between people that could have been playing a factor here. We don't have full information. Coroner's investigation is continuing.
Thank you, Dr. Mackie. Let's move to a question from Matthew Trevithick. Jane, I think we answered your question there. You were asking if there were still long-term care residents who haven't received their vaccinations. Dr. Mackie answered that just before. So let's go to the question from Matthew Trevithick at Global News Radio. Dr. Mackie, with more vaccine doses expected and more people set to become eligible, would the health unit consider a 24-hour vaccination clinic so more people could get immunized sooner?
Appreciate the question, Matthew. We really don't have a need for 24-hour vaccinations right now. We run 12-hour clinics 7 days a week. We haven't had any complaints about hours of clinics being an access issue. People are able to book in. And, one of the main drivers is around being able to recruit staff, particularly supervisors. We have a limit on the number of supervisors we can recruit. What that means is that although there are lots of vaccinators and we can add vaccinator capacity to have higher flow clinics as we need, and we do, we can't really add shifts very easily because that requires additional supervisor capacity, which is really scarce. So we believe that the 12-hour clinic model is the best for our community. Again, haven't had complaints, and we're burning through vaccine as quickly as it is coming in to our community. So, there isn't really a capacity issue that 24 hours would address in any way.
Thank you, Dr. Mackie. Being mindful of the time, we do have one last question, so this will be the one that wraps it up this afternoon. And it's from Andrew Graham. Dr. Mackie, what can you tell us about the 18-year-old's family? You mentioned they were sick as well, but how many people are in the family?
Yeah, don't have full information. I can tell you that one other person who's the main contact for the individual who is sick is also sick. That's about all we know at this point.
Thank you very much, Dr. Mackie, and thank you, Mayor Holder. That does bring us to the end of our questions for today. We appreciate your time and your information, and thank you for tuning in and joining us for this afternoon's virtual media briefing. We will be back on Monday afternoon at 2 p.m., and we look forward to seeing you then. So between now and next Monday, have a great rest of the week, enjoy the weekend, and we'll see you next week. Take care.